Here are the top 5 rotator cuff exercises that you can do to avoid rotator cuff surgery. Now, if you're someone that you're not sure what you did, you just started hurting your shoulder, maybe you got an MRI and it showed a rotator cuff tear, or you think maybe you have a rotator cuff tear, then this is the talk for you, specifically for people that aren't sure what they did. We see people like this all the time in our office where they've been given a diagnosis of rotator cuff tears and they are told they need to have surgery, but we've been able to help them avoid this surgery, and this is what we're going to be talking about today. So my name is Stephanie. I am a physical therapist and I own Empower Physical Therapy, and we really help people avoid surgery, injections, and medications and help them get their life back. We want to give you hope that it's possible because we see it in our office every single day. So when it comes to the rotator cuff, most of the time you'll go to a physical therapist and the first thing they want to do is rotator cuff exercises, and this is the wrong thing to do because we've got to get to the source of what's going on and why it's happening. And if we look at the mechanics of the shoulder, so what can happen is a lot of times the shoulder can kind of be moved forward a little bit, and when that happens it crowds the space in this shoulder. And most of the time when their shoulders rolled forward, it's because their ribs in the back are tight. So the shoulder blade has to be able to, if this is the shoulder blade, it has to be able to come down and in. But if those ribs are kind of stuck out, what happens is the shoulder blade comes more to the outside. And so when it comes more, I'm going to exaggerate it, comes more to the outside, the shoulder tends to be rolled forward. And so now when I try to raise my arm up, I can't. It pinches and it reduces the space where all those rotator cuff muscles come in and connect, and so it can create some pain. So what can we do to reduce some of that? You know, my first exercise that I love to show is doing some self-rib mobilization. So in between the shoulder blades, it's kind of tough to kind of get. So one of my tricks that we share with our clients is we use a tennis ball. And so what you're going to do is, now we're not doing this to kind of roll over like tightness in the muscles. You're going to feel that, definitely. We're going to be using this to actually mobilize ribs, because you'll find the spots that aren't moving because you'll be like, oh, that doesn't feel very good. And that's what you're going to basically be pressing down on. So what you'll do is you can lie down, or you can do this even on a wall if it's too painful. And you'll have the ball between your shoulder blade, and you can kind of roll up and down the shoulder blade, but you'll find some spots. And when you do, you're basically pushing the body into it and breathing just to mobilize those ribs. And you can kind of come to other spots, the same thing, push into the rib and just kind of mobilize that spot so we can start getting it moving. We sit a lot, we use a computer, we are doing things where we're always, using a mouse, and we're always, our shoulder tends to be rounded from doing this, using computer work, those kind of things, and that really affects those ribs because in these prolonged positions, it makes those ribs kind of move out, and so we've got to mobilize them to start getting them back to where we can actually get the shoulder blade down and back. And so that's the first exercise that we're going to do is take this and like every day, just push down on it, hold it for like maybe 10, 20 seconds, find another spot, hold it, go back through this, spend about 5 minutes on this and do it a couple times a day. And you'll start noticing as you do it, it's like, oh wow, this doesn't hurt as much. If it hurts too much, then you press less. If you don't feel it as much, then you press a little bit more. And so that's kind of what you want to do when you gauge through this. And so we have to get the mobility back first. My first phase of therapy, anytime I'm looking at anything, is looking at how do the joints move. And if we physically can't move, then it doesn't matter what we do strengthening wise. You're just going to go around it, or people will go really work on shoulder blade exercises, trying to get the muscles between the shoulder blade to really fire, and they just get more knotted because you're working them so hard because the body physically can't move in those positions. So mobility first. So that's the first thing. Now, the next one that I like to do, because we tend to be rounded, what happens is you recruit through your pec, and your pec attaches into the arm here. So it can really help round that out as well, because you're just used to using this all the time. You tend to use back through here, which is part of that rotator cuff. And so we want to get that all stretched out again, because if you've been like this for a while, you're probably going to have some tightness through that pec muscle. So my favorite exercise is get a little weight. This is just a 3-pound weight. I'd say 2 pounds, 3 pounds, 4 pounds. You just gauge, but you got to be able to like feel a good stretch, and we don't want this hurting. So what you'll do is you'll lie on your back and you'll have your arm off the edge. And this is just to rotate that hand down, because that pec, it shortens and it rotates it in. So we want to stretch it the opposite way by having something to, you can use a hammer as well, and the weight of the hammer goes down, and you're just going to really stretch through here. Feels really good. You can go closer to the table or away from the table. You're going to get more of a stretch. If you move closer in, you can do this on your bed. You're going to feel a little bit less of a stretch, so that's how you can kind of gauge it, and you can kind of move the arm in different positions. This really opens up that pec muscle, which is really, really important, because again, if it's tight, it's going to pull that shoulder in, meaning it's going to pull your shoulder in this way, and that's going to crowd the space of that rotator cuff. So those are another exercise, kind of a mobility exercise that we can do. So now let's work on some strengthening exercises. So a lot of times once we improve that mobility, now we've got to focus on getting the strength back through there so that the shoulder blade will actually operate correctly. So another exercise that we like to do here is working on improving the mobility into that shoulder blade. So you'll be on your hands and knees, and what you're going to want to do is you're going to sink your shoulder blades together. So it's not like our cat and cow. We're actually doing it through the shoulder blades. So you'll sink the shoulder blades together so that we can work on getting that full mobility of that shoulder blade, and then you're going to push up and round out, rounding between up through here, and then you'll come back down, bring those shoulder blades together. Again, this is kind of a mobility and strengthening exercise. Oftentimes what happens in that shoulder blade is because you're getting a lot of weakness because the shoulder blade kind of hangs out in this direction, you may get a little bit of a winging. So this will help with that winging. It's an exercise that works on the muscles underneath the shoulder blade so that it can bring that shoulder blade back down close to where the ribs are. And so that's what this exercise does. Plus it works on just improving that mobility of that shoulder blade being able to come in and the shoulder blade coming out. So that's another exercise that you can do. And I would say like 10, 15 of them once a day. You can do them twice a day if it's feeling really good. So the next exercise that we can do, we're going to give you 2 more strengthening exercises to work on that shoulder mobility. Because again, we want to make sure the shoulder's able to operate correctly so that it opens up the space in through here. If I'm here, it's going to crowd the space. It's going to pinch down. You're going to pinch down on that rotator cuff. But if I can get the shoulder down and back and move it, my range is going to be much better. I'm going to have more space where that rotator cuff is, and it's going to really calm things down. So this one's another good one. We're going to do it on our hands and knees again. And what you'll do is you're going to have one hand down. You're going to bring the shoulder blade down, and then you're going to kind of squeeze it in. So get that lower part of the trap through here to kind of squeeze in. And then you're going to just hold this position. And what you'll notice, it just works on endurance. You're going to notice your arm may start shaking. That's very normal. It's just you've had a lot of weakness because you haven't been able to actually recruit the correct muscles because the shoulder hasn't been able to move correctly. So you'll just hang out there, and you're going to start out with maybe 30 seconds of holding it. You can move up to like a minute and doing it a couple times, 2 to 3 times in a set, and then you can do those again like once a day. So that is the 4th exercise that you can do. Now the 5th exercise, again, is another strengthening one. I like this one as well because it really works on getting that lower trap. So if these are our shoulder blades, a lot of times that lower part of the shoulder blade is very weak. And so this is going to kind of start working on that lower part so the shoulder blade can kind of come down and in versus it wanting to come out like this. And so you'll just kind of bend over. You can start out with no weight, and then you can add weights to your hand. And you're going to, same thing, you're going to bring the shoulder blades down. Your arms are going to be like a W. And you're just going to squeeze the shoulder blades back, kind of like you're trying to touch your elbows behind your back so that you really get that lower part of that shoulder blade working. but you're not going to obviously touch it, but that's the motion we're looking for. So shoulder blades down, W position, raise and squeeze back, squeezing those shoulder blades together, squeezing those elbows together, and then coming back down. And again, doing this about, 8 to 15 times, depending on how weak you are, starting out once a day, then you can progress to twice a day. But if you start working on these, improving the mobility, and then working on some of the stability exercises, you're going to notice that your shoulder pain is going to start going away, and you're not going to have to worry about having that rotator cuff surgery. So again, if you like what you've seen and you want to continue to learn more from our channel, then make sure you subscribe to our channel because we put out content all the time.